Buoy Health Insights, Involuntary Movements. Welcome to Buoy Health Insights, where we dive deeply into health topics that matter to you. In today's video, we'll be exploring involuntary movements, those jerking, shaking, or uncoordinated motions that can accompany neurological illnesses. If you or someone you know has experienced involuntary movements, stick around to learn more about potential causes, other symptoms, and when it's time to seek medical care. What are involuntary movements? Well, as the name suggests, these are movements that you can't control, and they can sometimes be intensified by things like activity, stress, or fatigue. Involuntary movements are also known as tics, tremors, athetosis, or dystonia. Each of these has unique characteristics that can help pinpoint the possible underlying causes. Myoclonus, for example, is a muscle-jerking sensation. You might have felt this through hiccups or a sleep start. There are different types of myoclonus, ranging from action myoclonus, triggered by movement, to stimulus, sensitive myoclonus, which occurs in response to noise or light. Essential myoclonus occurs for no apparent reason, while epileptic myoclonus is a form of epilepsy, and secondary myoclonus can result from neurodegenerative diseases. Dystonia involves involuntary muscle spasms, where muscles contract and may not release readily. It often produces movements without purpose and can affect various parts of your body, including the neck, which can be painful. On the other hand, tremors involve more subtle shaking or trembling, which are most notable in the hands and can sometimes be seen even in children experiencing stress. Now let's talk about what could cause involuntary movements. These can range from symptoms that aren't serious, such as exhaustion, dehydration, or low blood sugar, to more concerning causes like drug reactions or neurologic dysfunction due to brain or spinal cord injuries, strokes, or brain tumors. Psychological factors can also play a role in involuntary movements, particularly in women, and are often linked to severe depression, anxiety, schizophrenia, or bipolar disorder. Neurological or neurodegenerative diseases are progressive conditions that gradually get worse and are sometimes related to genetic or autoimmune factors. What other symptoms might indicate these causes? For physical causes like exhaustion or dehydration, you might experience fatigue, thirst, and an increased heart rate. If drug reactions are the culprit, you might also notice rashes, dizziness, or changes in your thinking and alertness. For neurologic dysfunction or neurodegenerative diseases, accompanying symptoms can include memory loss, difficulty speaking or understanding language, and changes in coordination or balance. When should you be concerned? Some forms of involuntary movements, such as those caused by exhaustion or dehydration, can be resolved with rest, fluids, or food, and are not typically a cause for alarm. However, if you experience any new type of involuntary movement, may it be a tremor or muscle spasm, it's important to consult with a medical professional promptly. This is particularly crucial if you have a history of dystonia and are going through a significant physical or emotional shock. If you notice other serious symptoms such as confusion, severe headache, weakness on one side of the body, or trouble with vision or speech, seek immediate care, as these could be signs of a neurologic emergency. Before we conclude, let's summarize. Involuntary movements are uncontrollable and can indicate various underlying health conditions. It's important to pay attention to any accompanying symptoms and consult with a healthcare provider for a proper diagnosis and treatment plan. Thank you for tuning in to Buoy Health Insights. We hope this video provided you with valuable information about involuntary movements and their causes. If you found this video helpful, be sure to subscribe, and share it with someone who might find it beneficial.